Good afternoon, good morning, everyone, and thank you so much for joining us today on this webinar on digital advertising on a limited budget. We have a number of people who have registered for the event, so we'll give them about another minute or two to join us. So just hold tight and we'll get started in just 2 minutes. Thank you so much again for joining us today. Well, let's go ahead and get started. Again, thank you so much for joining us today on this webinar. My name is Andrew Zapfel, I'm Manager for Health Equity here at NASTAD. I'm really excited to have our colleagues again from Building Healthy Online Communities Coalition to really discuss today digital advertising on a limited budget. Just a bit of an agenda today. We're going to start with just some introductions and housekeeping, followed by an introduction to Jen Hecht from the Building Healthy Online Communities Coalition, who will then pass it over to our presenter today, speaking really on digital advertising on a limited budget. We'll then have time for discussion and share a little bit of next steps. Please note that we have included time, two areas of time for questions, and we'll get to that in just a moment. So just in terms of housekeeping, we do ask that you please mute your computer microphone or telephone during the presentations, and feel free to use the chat feature to ask any questions you may have. We'll address these during the two question and answer periods. You can do two different methods if you'd like. You can either type in your question in the question box in the GoToWebinar widget on the right side of your screen, as well as you can also raise your hand, which will allow me to see that, and I'll unmute your line to ask those questions yourselves. A recording of the webinar and slides will be made available after the call. Just give us a day or two just to process it via GoToWebinar, and we'll post it on the NASTAD website and share it out to all those who have registered for the webinar. For any additional information, please feel free to contact myself at azapfel@nastad.org. Now I'm going to pass it over to my colleague Jen Hecht at the Building Healthy Online Communities Coalition. Jen has over 20 years of experience in public health with a focus on sexual health and substance use. She has been focused on projects related to sexual health and dating apps, and is a co-founder of Building Healthy Online Communities, a consortium of public health and app owners working together to further HIV and STI prevention. Currently, she is based at San Francisco AIDS Foundation, where she leads program strategy and evaluation and directs Building Healthy Online Communities. Jen, I'll pass it over to you.
Andrew, making sure you can hear me. I unmuted myself.
Yes, I can hear you now. Great. Thank you, Jen.
Perfect. Thank you so much. Well, good morning, and for some, good afternoon. Thank you so much for taking the opportunity to participate today. I'm just going to take a moment to share a little bit about Building Healthy Online Communities. BHOC, for short, is a consortium of public health organizations that are working to leverage our relationships with the dating apps. Some of our public health partners include NASDAD, NCSD, CDC, AIDS United, San Francisco AIDS Foundation, and Emory University, and a number of others as well. And I really want to extend a big thank you to NASDAD, and particularly to Andrew for helping us host this webinar. We're working with most of the major dating apps, including Grindr, Scruff, and Jacked, Adam for Adam, Tinder, and a number of others. And we really have three primary goals at BHOC. First and foremost, we advocate for changes in the environment of the apps. So that's, for example, how the profile options or other features are set up so that we can achieve permanent solutions that promote health and reduce stigma. We also work to coordinate and improve messaging and advertising related to sexual health information and awareness and access to sexual health services through the apps. And finally, for us to succeed, we work to coordinate interactions with the apps and to assist them in prioritizing their efforts for the greatest impact. So you can find more about our work and our resources like tellyourpartner.org, and a number of resources that might be useful for you at bhocpartners.org. Finally, I want to note that we're working on a new project related to home testing, and if you want to learn more, again, you can check bhocpartners.org/home-testing. So a number of months ago, we hosted a meeting that was focused on improving the effectiveness of online ads for promoting sexual health. And we've developed a number of new resources, including a clearinghouse for ads that will be shared through this webinar. This is the second of 3 webinars, and I'm excited to introduce Matt Moss of Water and Stone, who's been working with us on a number of projects over the last years. Matt is a passionate marketing professional with over 15 years of experience leading digital marketing initiatives for blue chip brands, including Singapore Airlines, KB Home, and Viking Cruises, as well as public health groups, including AIDS United, California Department of Public Health, Office of AIDS, Desert AIDS Project, and UltiMed. Matt is working with Building Healthy Online Communities as NASDAD to help social marketers leverage proven strategies from the for-profit space to be more efficient and effective online so we can bring an end to the HIV epidemic. And now I'll turn it over to Matt to begin the second in our series of 3 webinars.
Thank you so much, Jen. Appreciate it. And thank you, Andrew. Once again, thank you all for joining me and us today. As Andrew mentioned, we will have 2 breaks in this session for questions. So I'm going to go kind of quickly, just so that I make sure we have enough time for you folks to ask questions, but you can type them into the chat and Andrew will filter them over to me. As Jen mentioned, this is the second in our series of webinars. So in the first webinar, we covered some basics about planning and executing a digital campaign. These included things like planning, budgeting, tracking and analytics, overcoming common barriers to marketing that many CBOs and health departments face, and also selecting media channels. If you didn't see that webinar, there's a link up here, first webinar, and then I will be reviewing a lot of this today as well, but I'm really going to kind of skim over some of these and focus more on how to apply these principles to campaigns with limited budgets. So regardless of the size of your budget, planning is still the most important part of any campaign. So I'm going to spend some time today talking about how to properly plan an advertising campaign. So when you're going through your planning, you're going to want to answer a few basic questions. While the questions may seem basic, the answers aren't always so basic. But first and foremost, what are you trying to achieve and why? This will give you your goals. Who are you trying to reach or influence? This will define your audience or your target audience, as we often call them. Why would this audience want to do what you want them to do? This is messaging. And then last but not least, of course, what resources do you have or need to do this campaign or your budget? All these questions should be answered and shared with the people involved in your campaign through what's often called a project brief, or as you folks commonly call it, a program plan. So in your program plan, you've probably defined a lot of this. So sharing that with any media partners or people who are helping you develop or plan or execute this campaign is important. Really, I'm going to start with talking a little bit about the creative and what ads you plan on running. The more relevant and compelling your ads are, the more likely your audience is to retain your message and take the action that you want them to take. However, developing new creative may not be realistic based on your budgets and timing, and so I highly recommend that when you have a very limited budget, you look at using existing creative from other organizations because it can save you substantial time and money. The CDC has a library of campaigns on a wide range of HIV prevention modalities available for use at no cost. They will also tailor those campaigns to your specific needs. If you tell them what channels you're running on and what sizes, they will do that work for you for free, which is really, really good. Building Healthy Online Communities has also compiled a clearinghouse of ads that you can go to and search for ad campaigns based on topic. And based on the audience you're trying to reach. So you can find campaigns either that you can use as inspiration, or many times you can contact the owners of those campaigns and they will let you use them. We're running a test right now with BHOC using excuse me, a campaign from the CDC and other campaigns that we sourced from health departments and CBOs, all of which had already run in the past. And so we've proven that this is possible and that it's actually really, really cost efficient. So I highly recommend this, because any dollar you save on creative development is a dollar you can spend reaching someone in your target audience or showing them your message. So it's really important to try to be as fiscally responsible as possible there. I want to talk a little bit about goals now. So when we talk about setting goals, oftentimes we need to also talk about the success metrics we're going to use to evaluate whether or not we achieve those goals. So here I've broken down some success metrics based on goal. And for a lot of you folks, this is process evaluation versus outcome evaluation. So when we start talking about process evaluation, there are things like generating awareness. Awareness is often measured by reach, the number of people that saw your message, impressions, the number of times someone saw your message, and web traffic. So how many people came to your website, and then what did they do there? Engagement is another process evaluation that we often use. This could be things like video views, social media likes, comments, shares, reactions, those types of things that show someone's engaged with the message that you're delivering. And then last but not least, conversions, right? And this is really outcome evaluation. How many people clicked to call? How many people filled out a form? Did people get directions to a care facility? Did they initiate live chats, or did they actually go into a clinic and visit? Obviously, the closer we can get to a connection to care when we're tracking outcomes, the better. But many of you will probably only be able to go so far as, click to calls, form fills, and directions to a care facility, unless you have a relationship with a clinic who can report back, etc. Talking a little bit more about goals, we usually use our goals then to establish a media strategy, right? And so if we're trying to generate awareness, our strategy is often to maximize reach within the population. So by that, I mean, try to show as many people the ad as possible, because that will make them aware of it. If our strategy is more about engagement, we're going to need to pair this reach strategy, but we're also going to have to look at our message and try to make our message as relevant as possible, because people are only going to share, engage with things that they understand and relate to. So in this case, if engagement is a focus, you're going to have to be really, really confident in your creative. And then conversion. This is where we want people to take an action. And so what we will do with the conversion strategy is we will increase the frequency that we show people an ad. So 1 time, 2 times, 3 times, 4 times, until we reach a point where we start to see a diminishing return based on conversion rate. So that means how many people are taking the action we want them to take over the period of time and based on how many ads we're showing them. Now, message relevance is really important here because obviously the more compelling our creative is, the more likely they are to do what we want them to do. But also, it's important to try to retarget visitors to your site when you're trying to drive conversion, because retargeting shows ads to people who have already been to your website. Now, this isn't going to be, depending on the content of your website, you may or may not be allowed by Google, Facebook to retarget. So it's important to try if you are trying to maximize conversion, because anyone who's been to your site once is more likely to return. They're already aware of your message. They've demonstrated interest by clicking through to your site to begin with. They're going to be more likely to take the action that you want them to take. And so we'll get into this a little more. I know I'm going fast, but the next thing I want to talk about is how to set budgets, right? So you've got your goals, and the best way, the optimal way to do media planning is to have goals and then set budgets to reach those goals. Now, that may not be possible for a lot of you on this call. You may have already been given a budget of $500, $1,000 to accomplish whatever goals you can, and we'll talk about that next. But in the optimal method, if you have goals, for example, I know I want to reach 15, I want to get 15 MSM to enroll in prep using Facebook advertising over the next 3 months. You can use media formulas and equations. Many of these I'll provide to you based on worksheets and downloadable, editable sheets later in the deck. But you can use these equations and some information from either past campaigns you've run or past campaigns other people have run with similar goals and similar audiences and similar markets to project out what you would need. So in this case, the things highlighted in pink are data that I've got from past campaigns. I can plug them in and figure out, okay, if I want to get 15 MSM to enroll in prep and I'm using Facebook, it's likely going to cost me $4,500. Now, so for most of you, this is probably not going to be where you're starting. You're probably going to be starting here, which is defining goals based on a budget that's already been decided for you. So in that case, you're going to use similar calculations to get to, realistic goals and objectives that you can achieve based on the budget you have. So in this case, I'm going to use an example of $500 to raise awareness for an HIV outbreak to MSM of color in Augusta, Georgia. Now, this is a campaign that we ran for AIDS United recently, and I'll show you some more data based on it. But this, you're really going to look at, if you have $500, you're going to try to look at, okay, where can I get the most reach, because awareness is my goal, for the money that I have. And you're going to determine that based on what's called cost per thousand impressions, or CPM. CPM is the most common way that you purchase advertising from any digital media channel. And it just means you're paying a certain dollar amount to show your ad 1,000 times. And so, you're also going to, if you want to build frequency, if you want to generate awareness, you're also going to want to look at a lower frequency. So you're only going to show your ad 3 or 4 times to each person in your audience, so that you can then reach the most people possible. So using this $500 example, if I know Facebook has a cost per 1,000 impressions of $12 to reach my audience, that means that I can divide 500 by 12 and figure out how many thousands of impressions I can show. In this case, I would be able to show the message to 13,888 MSMs of color 3 times, or 10,416 MSMs of color 4 times during the course of a campaign, right? And that's just basic math, right? 12 divided by 500 equals the number of thousands of impressions I'm going to be able to get. And the smaller your audience, so the lower your MSM of color population is, the more frequency you'd be able to show that audience for the exact same budget. So that's kind of how you would define your goals based on budget. If I knew I had $500, I'd say, okay, our goals are going to be, 48,000 impressions. Okay, I can reach that goal, right? Now, I'm sure a lot of you are wondering, so what is the minimum budget for doing digital advertising? And while that seems like a simple question, it's impacted by a number of different variables. And unfortunately, the answer is that depends. It depends on your target audience. So the size and desirability of that audience, how big is your target audience, right? A large audience will require more money to saturate than a smaller audience will. But in digital, sometimes advertisers can charge a premium for audiences that are really small. So it's important to look at, the channel that you're trying to use and what the CPM is for your particular audience. It's also going to depend on how much competition there is for your audience. So young, lower income audiences of color are often targeted by quick serve restaurants, discount mobile phone services, and other advertisers that could drive up the price of ads in bidding marketplaces. So Google, Facebook, Instagram all sell ads based on real-time bidding. So you're literally bidding against other people who are trying to reach the same audience for that impression. And this is often why I also encourage CBOs and public health organizations I work with, any social marketer, to communicate with each other, because if you are running a campaign to MSM of color and another organization is running advertising to that same audience in the same geographic area at the same time on the same digital channels, you folks are driving up the price on one another. You're both bidding against each other. So it's important to communicate and realize that you are in competition for bidding. Minimum budget also depends on what goals you're trying to achieve, right? So what are your desired outcomes? What do you want your audience to do? Increasing awareness, getting someone to read an ad, is much easier to achieve and will require significantly less money than motivating an action. So if you want them to just read your message, click and read more on your website, those are going to be cheaper than if you want them to take an action, especially an action in real life or IRL. It's also going to depend on how difficult it is for them to take this action. So digital actions are really simple, right? Clicking is easy. But going to a clinic in real life to get prep is much more difficult and involved, right? So the more involved your desired action is, the more ads you'll need to show and over a longer period of time to motivate action. So instead of just trying to build awareness where we may only have to show someone a message 3 or 4 times, you may have to show someone a message 8 to 10 times over a longer period to get them to actually go do something. Because they may not be ready to do it at the time. It's also a higher cost to them. So there's all these reasons why more frequency is going to be important when trying to motivate an action. Also, you want to consider how many times do you need your audience to take this action, right? Is this one and done? Do you want them to just go in and get on prep, or is this a testing campaign that you want them to get tested every 3 months over a certain period of time? Multiple actions will necessitate a longer period campaign period. So you may have to reduce reach or reduce frequency so that you can run your campaign for 6 months instead of 2, right? So those are things you have to consider as well. I want to show you this slide. It basically, your minimum budget based on goal. I took some campaign data that we had in the past and I plugged it in here to show you folks what I mean. So this is all based on a budget of $1,000. So if we use our AIDS United example, for $1,000, we can show our ad 446,000 times, right? We're going to get 982 clicks out of that, but based on our conversion rate, we might only get someone to do something we want them to do 5 times for $1,000. So in this example, and you can see how that changes based on the channel that we're using too. So for example, if I use the popular dating app Grindr, I'm only going to get 59,000 impressions and maybe 1 conversion, right? And so it changes based on the different channels that you're using and the cost they charge. So $1,000 could get you a lot of impressions, right? You can show 24,800 people your ad 6 times a month for 3 months, right? But it still might only get you 5 actions depending on the conversion rate, right? The rate at which people who see your ad take the action. So it's important to understand that and know when you're going into a campaign what you can expect. Because while this is a great budget for awareness, if I'm trying to get people to sign up for prep and I'm only going to get 5 people to do it, that may not be seen as success, right? So it's important to manage expectations accordingly. Also, I want to mention here that this is these are from 2 different campaigns, but this data is going to be very specific to audience, channel, geographic region, and time period that they were run. So I don't want you folks to just take these numbers and plug them in for what you can expect in your area unless you have no other data, right? Then you can use these as a starting point. But it's important to look at what you're actually going to get back based on your audience, your geo, your message, etc. So I just went through that really quickly, but that kind of covers planning. So I wanted to take a 3-minute, maybe 5-minute, 3 to 5 minute break here to answer any questions. Have we got any?
Great, thank you, Matt. Again, for anyone, if you'd like to type in your question now in the chat box, as well as there's also the ability to, if you can want to raise your hand and ask a question as well. Looks like we got one question. Let me put it up. The first question here is, how can you demonstrate awareness and engagement when you use non-digital media placement, such as on bus ads or gas pump toppers? So perhaps, I know we're focusing on the online space. Do you have any sort of tips on how to demonstrate awareness or engagement for non-digital spaces?
Yeah, of course. So in that case, you're going to want to use either vanity URLs, so custom URLs that then you can track traffic and drive back to a digital platform, or you're going to want to use, vanity phone numbers. So a specific phone number that someone could call off of there, because without that, without being able, those are trackable actions. Without any trackable action, all you're going to have to go off of is the projected impression numbers that you get from your media channel, and you'll never be able to verify those. But any outdoor media channel will provide you with a certain number of impressions, right? They'll say this billboard gets an estimated 44,000 impressions every month, or this bus stop gets an estimated 3,000 impressions. They'll do that for you.
Great, thank you. And could you review the term low frequency again? What did you mean by low frequency?
Sure. So frequency is the number of times a person sees your ad. So someone in your audience sees your ad. So a lower frequency means I'm only going to show it to them 3 or 4 times over a given period, whereas a high frequency could be 8 to 10 times of one person seeing my ad. So the same person sees it less times over a given period versus more.
Great, thank you. And one more question we have, and I'll see if there's any additional ones, but the next question is, how are you able to direct ads to men who have sex with men on Facebook? Facebook wouldn't allow targeting men and Christian men in the past. So what is the best way of going about targeting this population on Facebook?
Great question, and I'm going to get into that a little later when I start reviewing the channel specifically. So I'd like to just hold off on that because I'll come back to it in my presentation.
Sure. All the questions we have them up. Actually, let me see here. It looks like we have. Just checking to make sure I've got all the questions. Looks like any additional questions, feel free to use the chat feature.
Yeah, and we'll have another chance at the end of the deck as well to answer additional questions. So I'm going to move on.
Great, thank you.
Okay, so we just had a question about targeting on Facebook. And so now I'm going to go over the media channels. So the right media channel will allow you to reach your priority population with a compelling message when they are willing to receive it and for a reasonable cost. The digital media channels I'm going to review today are the 3 major channels that we use when targeting MSM, or men who have sex with men. The first one is Google Display Network. This includes ads run across millions of websites and apps based on user information. Facebook and Instagram, 2 of the most popular social networking sites in the world, also based on user information. And then, of course, the dating apps, things like Grindr, Adam for Adam, etc., which allow us to run ads on these applications that men use to find new partners based on the user's geographic location. I'm going to start with Google Display Network because this channel gives you access to just millions and millions of users of websites and applications across the world. It's by far the largest digital advertising channel available, and it will allow you to show your ads to more members of your priority population than any other digital channel. Google has a lot of overlap, so I can buy through Google Display Network and then potentially show ads on dating sites as well, or on dating apps as well. So it's a really good channel to check out. It offers you by far the widest variety of targeting parameters, which means that we can be very specific about the people we want to show our ads to. Google also allows us to pay for ads based on a number of different metrics. So we talked earlier about paying for ads based on impression. So that's CPM, or the number of times your ad is seen. Google will also let you pay for ads based on clicks, so the number of times someone clicks on it. And if you've got the right tracking set up on your website, Google will also let you pay for ads based on conversion. So I can literally pay, a certain amount, set a budget for the number of times I want someone to use a service locator. And that's unique to Google. Also, all of these costs are based on real-time bidding with other advertisers. So you're paying what I would call a fair market rate when you're buying these ads. Because of the vast reach of this network and the highly customizable target capabilities, Google Display Network can be one of the most efficient and effective digital advertising channels for marketers that know how to use it. That last part, for marketers that know how to use it, is very important because as that question referred to earlier, how do we know we're targeting MSM? Certain channels don't let us do it. Google and Facebook in particular don't have a magical MSM audience that you can just check a box and show ads to. So the way that we do this is using a number of different targeting parameters. So we can start with demographics, right? Gender, age, household income, are they married or single? Are they parents or not, right? So when we start looking at this, if we're trying to reach MSM, we're going to focus purely on men, right? And we're going to look at 18 to 54 and probably not parents. Now, I know that that's not universally true, but we have to make some broad assumptions here to start to focus our audience. We're then going to start to layer on other things like affinity and custom affinity audiences. So showing ads to people based on interest groups, like are they foodies? Are they health and fitness buffs? Are they news junkies? Are they avid readers of men's media? Are they men's media fans? Those types of things we are allowed to target within Google. And we can also look at if they have if they're interested in particular websites, right? So we can go look at popular MSM websites and say, okay, people who have visited these sites, we want to also target that. And this is very helpful in creating an audience. We can also do custom intent audiences, which is something I highly recommend, which is creating audiences based on keywords that they may be using in search engines, right? So this is a great place to start, and Jen and BHOC have compiled a list of keywords that myself and others in the space have used to appropriately reach MSM. So I highly encourage you to take a look at that, and there's a link in the resource section of this deck to that document. And then last but not least, remarketing. So Facebook also, like Google, allows you to remarket or retarget. So you can put a pixel on your website that allows you to serve ads to people who have already visited your website. And so that can be really, really effective, like I said earlier, at driving conversion. They may have come once, weren't ready to take the action that you wanted, so you show them ads to get them back to take that action. So talking about Facebook and Instagram also gives you access to millions of people who are on Facebook and Instagram. You can target based on a lot of the things I just talked about: demographic, geographic, and interest-based. It also allows you to pay for ads on a number of different ways, from impressions, clicks, and video views, or engagement conversions, if you will. This is also can be very highly effective if you know how to use it. And I just spoke a little bit about, I just spoke a little bit about that, but I'd like to just take a break here and reiterate. The way to target MSM on Facebook or Google is to create audiences based on interests that are most likely associated with MSM. So in Facebook in particular, what pages or what profiles might they be liking and following? That's a very effective method of trying to find MSM. And you may have to play with your targeting here or there and adjust it, because Facebook may try to shut down anything that they think is specifically targeting someone based on sexual orientation, or because they're MSM. So we've had a lot of success doing this. So finding starting to target people who follow anything about pride, starting to target people who follow anything about HIV, starting to look at people who follow certain types of profiles that are, particularly MSM and GBTQ leaders, or organizations and causes. All of those things can help to create a better audience, but there's still no guarantee, right? The only channel that's the best, the closest thing to a guarantee in reaching MSM is dating apps. And there are a number of apps out there that men use to find new partners, but the audience is almost exclusively MSM, right? For if you find the right app, which means you don't have to worry about creating these audiences and then potentially wasting media dollars showing your ads to people who aren't within your target audience, like MSM. So because of the nature of these applications, right, users also have a higher likelihood of being sexually active with multiple partners, putting them at increased risk for HIV and STDs. Apps like Grindr, Jacked, Adam for Adam, and others make it really easy to show your message to MSM, but they charge a premium to reach this audience. And users may or may not be receptive to a sexual health message when they're trying to find someone to hook up with, right? They may not be the most receptive to how dangerous the activity they're about to engage in is when they're trying to engage in that action. But all that being said, again, it is the number one way to make sure you're reaching MSM. Dating apps only allow you to buy ads based on impression or the number of times your ads are seen, and they set the cost based on pretty much how they feel that day, unfortunately. But they'll tell you it's based on the area that you're targeting, but they always set the cost themselves, and that cost is always higher than Google and Facebook. Most GBTQ dating apps will only allow you to target based on geographic location. So, you can pick a state, a zip code, a city, but that's about it. So selecting a channel based on your goals. If you're how do you pick a channel, right? So we just went over how you can target and what the 3 channels are. Now we're going to talk about how to evaluate them against what you're trying to do. And so if you're trying to build awareness, right, you're going to look for the channel with the lowest cost per impression, or lowest CPM, because it will allow you to reach the largest number of people with the largest frequency. On the other hand, if you're trying to get an action, you may want to look at you're going to want to look at what vehicle or combination of vehicles will get you the most actions for the lowest cost. And that's not always the same as lowest cost per thousand or CPM. So I pulled campaign data from 3 different campaigns that I've run in the past, and I put it into this deck to illustrate 2 things. One, Google is always cheaper than Grindr and Jacked. 2, the cost and click-through rate, which is CTR, cost per click and conversion rate, can vary wildly from campaign to campaign based on what we're trying to do, because these campaigns were run in different geographic locations. They were all targeting MSM, but they also asked these MSM to do different things, right? On this Facebook example, we were trying to get people for AltMed, we were trying to get people to sign up for a prep appointment, right? Where in MSMs of color in Los Angeles, try and get them to sign up for a prep appointment. Very different conversion rate. Google, for this AIDS United ad, Grindr and Jacked, we ran the same ad campaign and just wanted people to click through and go to a website. And this was a campaign, Start Talking, Stop HIV, that we got from the CDC. You can see that in this one campaign where we used these 3 specific channels, we were doing this in Georgia. We had a very different cost basis than when we started doing this again for building healthy online communities last month in 6 different counties in California. You can see Google had almost half the cost and twice the click-through rate, with a fifth of the cost per click and double the conversion rates for this campaign, just because we were doing it in a different area with a different audience at a different time, right? And you can see Jacked here had a cost per thousand of $169, which was, significantly higher than their $8.76 cost per thousand in this other campaign. So this is just to illustrate the point that you're going to want to evaluate. The more data you have to make these calculations initially, the better off you'll be. However, your campaign will be different. It will act differently. You will get different numbers. So you want to start with a plan and then evaluate and adjust your plan according to what your actual outcomes are. You can also select channels based on your audience, and I encourage you to use this as a guiding principle, right? Because reaching the right people should be your priority and your primary consideration. So like I said earlier, there is no magic MSM audience for targeting on Google and Facebook. So if you aren't confident that you can target MSM well, you should definitely look at dating apps as your first channel to use in your campaign, because they're the simplest way to ensure that you're showing your ads to an MSM audience. Now, most digital advertising agencies have the capability to target MSM on Google and Facebook, right? I can do that very simply and effectively because I've done it many times and we have audiences that we know work. We're working to share those audiences with you folks through organizations like Building Healthy Online Communities. But if you were to go out and try to engage an advertising agency or a marketing agency to do this for you, you're probably going to want to have a minimum budget of at least $30,000 to spend on media. And the reason is because you're going to spend at least $6 grand with them just to get them to plan and manage your campaign for you. And so, trying to limit that expense versus the media expense and keeping it to around 20% is reasonable. As your budget comes down, you're going to pay the same in planning, but you're just going to have less money to spend actually showing your ads to people. So if you don't have around 30K, I'd suggest you try to handle this internally as opposed to going out and hiring people. I'm going to go through some media planning examples now based on the information I just gave, and then we'll have some time for questions at the end here. So the first media planning example is for awareness, and this would be to raise awareness of PrEP in MSM in Augusta, Georgia. We're going to start with a budget of $1,000. Our target audience is going to be MSM 18 years or over. Our geographic location, Augusta, Georgia, and the surrounding metro areas. The success metrics we're going to use are impressions, clicks to the website, and service locator usage. So for this campaign, because my budget is $1,000, highly recommend dating apps because guarantee we're going to reach that MSM audience, as I talked about before. So we can use a calculator like this one to project the outcomes we can expect. So in this case, we plug in $1,000 budget. We use some CPM data or cost per thousand data from a previous campaign of 1684. We know we can get around 60,000 impressions with a click-through rate of 1.72, which was, again, data we had from another one, the campaign we already ran, which gives us a clicks of 1,000 clicks and about $1 cost per click, right? And so with an estimated MSM population of around 4,800 in Augusta, Georgia, we can show our message to each member of our audience 12 times, allowing us to do pretty heavy frequency for a short period. So we could show our ad 3 times a week for 4 weeks, right, to get to that 12, or we could do less frequency over a longer period. We could show our ad 6 times a month to each person for 2 months, right? And so that gets back to that frequency, lower frequency, higher frequency question. It's important to note here that, as I mentioned before, these numbers are just a starting point, right? This is just an estimate based on past campaign data informing what we think could happen in the future. Once we start running our advertising, we need to track and then make optimizations according to the results that we see. That may involve shifting dollars from one place to another. It may involve changing creative, right? There's a whole bunch of ways to optimize, but it's just important to track and see how you are tracking to your estimates, and then try to make improvements to exceed those estimates, right? Or beat them. With one media channel, also the reason why I'm focusing on dating apps here, one media channel lowers the amount of creative development you'll need to do. So each of these channels could have different media creative sizes. So the ads could be different sizes. They could have different requirements. You can only have so much copy on an ad in Facebook versus the amount of copy you can have in Google Display versus the size of an ad on a dating app. All of these things are going to add complexity, and the more channels you have, the more complex it is to, 1, create ads for all those different channels, and then 2, track and attribute the traffic that you're getting from those channels back to the appropriate channel. So if I'm running ads on Facebook, Instagram, Google, and Grindr, if I want to know what the Facebook is getting me, I need to have special tracking in place to differentiate that traffic from Grindr and Google. If I'm only running on Grindr, I know all the traffic I got to my website came from Grindr. Media example number 2. So some of you may not be able to run ads on dating apps because of restrictions or other barriers put into place. I know some public health departments aren't allowed to do this. Some CBOs may not be able to. So if I wasn't allowed to run on dating apps, this would be how I would spend $1,000 to do the exact same thing to the exact same target audience. I would run on Google because it has the lowest cost per thousand, and I would run on Facebook because it has the second lowest cost per thousand and the highest engagement metrics. So how do you calculate that? Looking at, you can, and again, all of these calculators are in links on the back of this, so you can download and use them as you see fit. But in this case, I took Augusta, Georgia, I found its population, I multiplied it by the percentage of males that were in that population, and then I looked at the percentage, about 1 in 5 males being MSM, that ranges, but we just took that as a number here. And then we looked at, okay, based on that would give us our MSM population. Then if I wanted to get coverage of 130% of that population, because that number is above 100%, because I know I'm going to have some type of media waste, right? I'm assuming here that I'm going to show my message to 30% of the people I show my message to may not be MSM. So I want 130% to try to cover me. And then I can see how many impressions I would need and what those would cost based on the CPMs that I've gotten in the past, right? So in this case, it's important to note again, right? Starting point. This is all past data. So here's how I would do that spend. Here's what I could expect, right? I could expect a total frequency of 37 times per person in my audience over a 3-month period, which is really good, and the clicks that I could expect. So I can create a plan and then see how we are working to that plan, right? And that will help me hold my media and my campaign accountable, and then will also help me demonstrate to other people whether or not we achieve success and to what level. Again, in order to get this information though, you're either going to need to have run campaigns in the past, or you're going to need to get it from another organization that has. So it's important to share campaign data with each other as well. And myself and BHOC are happy to do that. So if you are trying to do this planning and you have questions, please reach out, and my email is at the end of this. So we've got our plan, we've started to run advertising, but we need to make sure we can track and analyze what is happening so that we can see how we are trending based on our performance. So there are 2 major ways to do this. Google's platform using Google Analytics is the #1 way, right? Every digital campaign should have Google Analytics associated with it. So this lives on your website, and it provides the most accurate information about where your site traffic is coming from, what they look like, what device they're on, what browser they're on, what time, where they're located, and also what they're doing on your site. All of this data will be tracked and available to you through Google Analytics. You can also set goals in Google Analytics to see when site visitors take a specific action, right? So if they used a prep locator, if they started a chat, those types of things. And when we pair Google Analytics with Google Tag Manager, we can track traffic from anything. So we can put unique tracking links on Facebook ads, on Facebook posts, on our bus benches, on those types of things that make sure we can track back to the campaign itself. So these are 2 powerful tools that I highly recommend using together. And so obviously the next platform, Google is important. I would use it on everything. Then you're going to have specific tracking for whatever platform you decide to use. So for example, Facebook and Instagram, you have their own tracking and analytics system. Grindr and Twitter, YouTube, they all offer their own tracking. So when you run ads, they'll tell you how many people saw it, how many people clicked, those types of things. So depending on the channel you choose as well, you'll want to use their platform for tracking too, in conjunction with Google. Now, it's important to have all this tracking set up before you start your campaign, and it will all be based on goal, right? And you should be evaluating your campaign at regular intervals, right? And your metrics that you use to evaluate it should be consistent so that you can demonstrate success, right? So that's why it was important to set your goals up front. If we're tracking clicks, if we're tracking views, those types of things. And then we want to make sure we're evaluating at regular periods. I like to evaluate weekly and then do monthly reports, but this is going to depend on the resources you have available, right? And the duration of your campaign. If your campaign's only 1 month, you may want to do weekly reporting, right? Evaluate daily, report weekly. If your campaign's a year long, right, you may be evaluating every 2 weeks and just doing monthly reports or quarterly reports. Totally depends what you need. If your resources are lacking, right, you can decrease the frequency of evaluation and reporting accordingly. But it's important to communicate what you will need in your final report to the people doing the reporting upfront, right? So, if you have certain metrics that your funders are going to require you to deliver on, know that upfront, plan accordingly so that you have the right tracking to do it. That really kind of completes the information sharing portion of this. I'm going to do some key takeaways, and then we'll have about 10 minutes for questions. So key takeaways here, right? Planning is the most important thing, but it requires data to be accurate. So share your data with one another. And I'm happy to share again, and Jen, the BHOC is sharing. We're all in this together. Two, every dollar you can save on creative development is another dollar you can spend showing your ads to your audience. So try to share creative as well, or try to source creative from other people. Dating apps are the easiest way to reach MSM, but they may not be the most efficient depending on your targeting capabilities. So they might be expensive compared to Google and Facebook if you're good at targeting, right? And the flip side of that is true too. Google and Facebook will be cheaper than dating apps, but they require more expertise to ensure you're reaching MSM. Smaller budgets are good for creating awareness and may be fine, but larger budgets are going to be required for motivating an action. As we saw earlier, you can get 500,000 impressions, but you might only get 5 actions out of that. And then many, many organizations have done this work before you. Many more will do it after you. It's important to try to reach out to those people and see if they're willing to share data, creative, and or any learnings that they've achieved so that you're not starting from scratch and so you can be most efficient. And so with that, we've got 10 minutes for questions.
Awesome. Thank you so much for that great presentation. I know we have quite a few questions already coming in, but just as a reminder, feel free to type in your question and then we will be happy to read them off. And if we don't have time for your question, we'll definitely try to follow up as soon as possible after the webinar. So just a few questions. I'm going to try to combine a few because we've kind of have some few similar questions here. So the first question kind of here is, how can you create a baseline of data if an organization doesn't have social media data or hasn't done this before? And alongside that is, where do you get estimated populations for an area? What can we see as a success of reaching a number of people, trying to find like number of MSM in an area? What best ways would be going about trying to get that information as well?
Good questions. So let me start with the population question, because that's easier to answer. So just you can go look at survey data to see how many men are in a certain area and then make guesstimates based on, or just look at a population from the most recent census data, take 48% of that for men and then 20% of that for MSM as a starting point. You can also look at some of the dating apps and see how many users. Their media plan will tell you how many users they have in a certain area, which can also help inform that number. So that was kind of that section of the question. Can you repeat the other part of that? Sorry, Andrew.
Oh, sure, no problem. It's more focused on, when you're looking at population size, is there ways of seeing how many of a population would be in a certain area?
Got it. Okay, so I answered that one, but the one I remember now. So the other one was about how do you, if you don't have this data already, how do you get it, right? So if you've never done anything on social before, you've never done this before, you can get this from other organizations in your area. So you could try to reach out to, starting with the CDC and see if they have campaign data that can help you inform you. There's also in the back of this deck, there's resources here. So you'll be able to see there's a media budget calculator right here. Number 10 and number 11 have some data that I've already used in this deck and that I've compiled over different campaigns that you can use as a starting point. We're also putting together a document with Building Healthy Online Communities about other campaign outcomes. So we'll make that available too.
Great, thank you. And just along that, I have a few questions here. Just noting that this webinar has been recorded and the slides will be made available. We do ask that you just give us a day or two just to combine all the information. It'll be posted to NASTAD's website and we'll share to you via email to all of those who've registered for the webinar, a link to the slides and the recording as well. So just want to make sure that is clear as well. Let me add here. So the next question here is interesting. How do you respond to non-focused populations who complain they are seeing ads and they no longer want to see those ads meant for your target population? Some we're worried about wanting to avoid our campaign being flagged or closed because we're not actually reaching with ads the intended population.
Yes, great question. This has happened to me a number of times. So there are two reasons for this. One, you're not doing a great job of targeting, or two, you are reaching someone who demonstrates the propensities or shares the behaviors, right, that are associated with your target population and may in fact even be in that population and just don't want to others to know they are. So how do you handle that? One, it's important to have buy-in from whatever organization that the work that you're doing is important and that they're going to defend you. Two, there are ways depending on the platform, there are ways to add people to lists to keep them off of your advertising. So for Facebook, this happened to us in Facebook, for example. We had a number of people who were not in our population starting to make, disparaging comments on things that we were doing on our ads, et cetera. And because we didn't want people to see that, we blocked those users. You can put them on a do not advertise list in Facebook. On Google and in other places, it's more difficult. So you would have to go back and look at your targeting parameters and make them more specific. Try to understand where that person saw your ad, what site were they on, or what profile were they on, and then remove that site or block that site in the same way you would block any other site you didn't want to be on.
Great, thank you. Do a final ask. Are there any additional questions people would like to add? Quite a few comments saying this has been very informative, so thank you for those. I'll give another minute to see if anyone has any additional questions.
Cool. While we do that, if you guys have questions, go ahead. I'm just going to walk through some of the next steps. So again, questions now, great. Questions later, here's my email. You can shoot me an email anytime. Happy to, to lend any expertise I can. There's also a resources section, as I mentioned earlier and I just showed. So here you'll get a lot of basics about how to do what we just talked about. So setting up a Google buy, Google ad buy, setting up Google display, Facebook buys, Grindr self-service sign up, and where to do that. The advertising clearinghouse is here, right? The list of number 6, BHOC's keyword summary list. So, to that person who asked about Facebook, go to this list of keywords that we use. You'll see it broken down by Google and Facebook, and you can start there, right? Just copy and paste those, change your zip codes, have at it. There's some dating app info and then some calculators down here, along with a media brief and a brief template if you wanted to use those as well. So.
Great, thank you. And just a note to everyone, this webinar will be housed on the NASTAD website. If you go to www.nastad.org and go to the top at meetings and webinars, you'll be able to click on that and see from our previous webinars what has been hosted, and this will be posted the next day or so. Just to note as well, we do appreciate your feedback. I'm currently submitting in the chat feature. We appreciate your feedback. Please take a moment to complete our survey, which can be found at the link provided. I'll also be sending the link out as well when we have sent out the slides and recordings. And yes, so we thank you so much for that. But again, thank you all so much for your questions. And Matt, I'll turn it over to you or Jen to kind of announce our next steps.
Great. We are going to be having another webinar on February 18th, so keep an eye out for that one. And Andrew and NASTAD will be sending around the invite for that, so make sure you register. Also, as I mentioned, if you have questions, send them to me. If not, check out the resource section of the deck for the helpful tools, and then you might have some questions coming out after you do that. So please feel free to reach out to me anytime, and I will do my best to help. Anything else, Jen, do you have?
Well, I just want to thank both Matt and Andrew. That was really excellent, Matt. Thank you for sharing so much really helpful resources and walking us through these different steps. I also want to remind the question about kind of population size. I want to remind folks of a couple of resources. So first of all, if you're based at a health department or a community-based organization, think about reaching out to your local health department. Their epidemiologists and surveillance teams should really have a lot of information about MSM populations. And then Emory has created a resource tool called CAMP, C-A-M-P, that helps with that information as well. So I encourage you to check that out. And again, thank you. Please check out many, many, many resources that we've compiled for you all, and hopefully that will be helpful as you're moving forward with the work that you're doing.
Great. Thank you again so much for joining us today on this webinar. We're at the end of the hour. If you have any additional questions, you can see Matt's email as well, or feel free to reach out to me as well at azapfel@nastad.org. Just a reminder too, in the chat feature, there is a evaluation, just short, 3 questions, should take you about 2-3 minutes tops. We appreciate any and all feedback to make sure these webinars are meeting your needs, as well as we're developing new webinars on the topics that you most likely would like to discuss. Thank you again so much for being with us today. We hope you have a great rest of your day and have a great rest of your week. Thank you so much.
Thanks.